Today's topic is what anxiety is really trying to do and why it feels the way it does. So, we're going to open with the Sunday scaries. Have you ever noticed that anxiety doesn't always wait until Monday morning? Sometimes it starts Sunday evening. You have a wonderful weekend. Maybe you spend time with family. Maybe you watch football, worked in the yard, went to church, or maybe for the first time all week, you actually relaxed. And then around 6 o'clock Sunday evening, your brain remembers tomorrow's Monday. Almost instantly, something changes. Your stomach tightens, your shoulders tense, your mind starts making lists. I have that meeting the first thing tomorrow. Did I finish that project? What if my boss asks me something I'm not prepared for? Did I answer that email? Maybe I should just check my email one more time. You tell yourself, stop thinking about work, but your brain don't listen. Instead, the thoughts multiply. One thought becomes five, five becomes 20, and by bedtime, you're exhausted. But you can't sleep. Your shoulders are tight. Your stomach feels uneasy. Your heart beats just a little faster. You check the clock. 10:45, 11:30, 12:15. You finally fall asleep, only to wake up 2 or 3 times during the night. And then Monday morning arrives, and you're already mentally exhausted before your feet even hit the floor. If that sounds familiar, today's video is for you because anxiety is so much more than worrying. Hi everyone, I'm Robin Trivett, a psychiatric mental health nurse practitioner. One of the biggest myths I hear from my patients almost every day is, I don't think I have anxiety because I don't really worry that much. The truth is, many people with anxiety don't spend every minute worrying. Some experience anxiety mostly in their bodies. Some notice it in their behaviors. Others don't recognize it at all until someone points it out. And so today, I don't want to talk about anxiety from a textbook. I want to talk about what anxiety actually feels like, and more importantly, what it's trying to do. Because if you've ever wondered, why does my brain do this to me? I think we're asking the wrong question. Instead of asking, why do I have anxiety? I think we should ask, what is my anxiety trying to do? Because when you understand that, everything starts making a little more sense. Anxiety is trying to protect you. Here's something I tell my patients almost every week. Your anxiety isn't trying to ruin your life. It isn't trying to make you miserable. It isn't trying to make you weak. It's trying to protect you. Now, before you click away, hear me out. Your brain has had one job for thousands of years. Notice danger. Avoid danger. Keep you alive. Thousands of years ago, danger looked like wild animals, storms, enemy tribes, not knowing where your next meal would come from. And today, these dangers have changed. Now your brain sees danger in job interviews, public speaking, making mistakes, financial stress, health concerns, relationships, conflict, uncertainty. Your brain doesn't always know the difference between a tiger hiding in the bushes and an uncomfortable email sitting in your inbox. Imagine having the world's most loyal security guard. His only job is to keep you safe. But somewhere along the way, he stopped recognizing the difference between a robber and the UPS driver. Every sound becomes an emergency. Every knock at the door becomes danger. That's anxiety. It's not a bad security system, it's an overprotective one. Anxiety is trying to predict the future. One of the first things anxiety does is pull you out of the present. Have you ever noticed anxiety almost never talks about right now? It talks about tomorrow, next week, next month, next year. It keeps asking, what if? What if I fail? What if they don't like me? What if something happens to my child? What if I embarrass myself? What if I get sick? What if I make the wrong decision? Anxiety believes if I can think about every bad thing that might happen, maybe I can stop it from happening. It sounds helpful, but it isn't. Because life doesn't work that way. The more your brain tries to predict every possible outcome, the more anxious it becomes. Because uncertainty can never be completely eliminated. And here's something I want you to think about. Have you ever noticed anxiety almost never asks, what if everything works out? It doesn't ask, what if I do a great job? What if people enjoy talking to me? What if my test goes well? Anxiety has a negativity bias. It searches for danger because that's what it believes will keep you safe. Anxiety is trying to prepare you. Preparation isn't bad. In fact, preparation is healthy. If you have a presentation tomorrow, it's normal to practice it. It's normal to think about what you're going to say. That's preparation. But anxiety doesn't always know when to stop. Preparation becomes rehearsal. Rehearsal becomes overthinking. Overthinking becomes suffering. Instead of practicing your presentation once, you practice it 50 times. You imagine forgetting your words. You imagine people laughing. You imagine your boss looking disappointed. You imagine losing your job. By 2 o'clock in the morning, your brain has turned one presentation into a disaster movie. Why? Because anxiety believes if I imagine the worst, I'll be ready if it happens. Except you've already suffered through something that never happened. Anxiety is trying to protect you from emotional pain. Most people think anxiety is trying to protect us from physical danger, and sometimes it is, but often it's trying to protect us from emotional pain, rejection, embarrassment, failure, disappointment, judgment, shame. Think about the last time someone invited you somewhere. Maybe your first thought was, I don't really want to go. But if you're honest, was it really that you didn't want to go? Or was anxiety trying to protect you from feeling uncomfortable, from saying the wrong thing, from not fitting in, from feeling judged? Anxiety loves avoidance because every time you avoid something, the brain says, see, I kept you safe. The problem is your world will slowly become smaller. You stop trying new things. You stop speaking up. You stop meeting people. You stop taking opportunities. Sometimes anxiety would rather keep you lonely than risk rejection. Anxiety is trying to get your attention. One of the biggest misconceptions about anxiety is that it's all in your head. It isn't. Your brain can't text you. It can't send you an email. So it speaks the language your body understands. Maybe your shoulders stay tight all day. Maybe your jaw aches because you're clenching it without realizing it. Maybe your stomach is constantly upset. You get headaches. You feel exhausted. Your chest feels tight. Your heart races. You feel dizzy. Or you keep thinking, I can't catch my breath. These symptoms are real. You're not imagining them. They're signs your brain activated your body's alarm system. It's preparing you to fight, run, or survive. The problem is, most of the time, there isn't an actual emergency. Your body is responding to an alarm, not to real danger. Anxiety doesn't know when to stop. Healthy anxiety protects us. It reminds us to study for the exam. Disordered anxiety says, study until 3 in the morning because if you fall asleep, you'll fail. Healthy anxiety reminds us to lock the front door. Disordered anxiety says, go check it again. And then just one more time, just to be sure. Healthy anxiety encourages us to prepare. Disordered anxiety convinces us that nothing is ever enough. Healthy anxiety clocks out. Disordered anxiety works overtime, and that's exhausting. How do we retrain an overprotective brain? Here's the good news. Our brains are capable of learning. If anxiety learned to see the danger everywhere, it can also learn safety again. That doesn't happen overnight, and it doesn't happen by simply telling yourself, stop worrying. Recovery happens one experience at a time. We start by challenging anxious predictions instead of accepting them as facts. We gently ask, is this fear based on evidence, or is my anxiety filling in the blanks? We gradually face situations that we've been avoiding, not because it's easy, but because every time we stay in a situation long enough to discover that we're safe, our brain learns something new. We calm the nervous system through slow breathing and grounding exercises. Not because these techniques make anxiety magically disappear, but because they send a message to the brain that says, right now, I'm safe. We take care of our bodies through sleep, movement, good nutrition, and meaningful connection with other people, because a healthy brain functions best in a healthy body. And for many people, therapy can teach the brain new patterns. Medication can reduce the volume of an overactive alarm system. Neither one changes who you are. They simply help your brain respond more appropriately to the world around you. Recovery isn't about becoming fearless. It's about teaching your brain the difference between danger and discomfort. So maybe next Sunday, your brain starts whispering, tomorrow's Monday. Maybe your stomach tightens. Maybe your shoulders tense. Maybe the what ifs begin. And when they do, I hope that you'll remember something. Your anxiety isn't trying to hurt you. It's trying to protect you. It just hasn't learned the difference between possibility and probability, between uncertainty and danger. The wonderful thing about the brain is that it can learn with time, with practice, with patience, with support. Your overprotective brain can become a wiser one. If this video helped you understand your anxiety a little better, let me know in the comments what part resonated with you the most. And if you know someone who's constantly asking, why does my brain do this? Consider sharing this video with them. Sometimes understanding what's happening is the first step toward healing. Until next time, be kind to your mind.